let's get you the big story in the national capital. Certainly one that could be reflected across India. First, Delhi's RValue, which indicates the spread of COVID-19, was recorded at 2.1 this week, implying that every infected person is infecting two others. Delhi reported 1,094 fresh COVID-19 cases, 640 recoveries and 2 deaths in the last 24 hours. The positivity rate inched up to 4.82%. Is it time to worry?
India has reported over 2,000 daily COVID cases for the past 4 days. A significant rise from the first week of April, when the average cases were around 1,000 a day. The largest contributor in fresh cases has been the national capital in the past 2 weeks. Not surprisingly, Delhi's RValue is now 2, which means each positive case is infecting 2 others. On Friday, Delhi reported 1,042 cases, over 40% of the overall cases in the country. COVID situation in Delhi has sharply deteriorated in the past 1 week. Delhi's pandemic reproduction rate now 2.1, says IIT-Madras study. Daily COVID cases reported on Friday, 1,042 from 366 a week back, a rise of over 284% in a week. Active cases up to 2,241 from 706 in a week. Positivity rate up to 4.64% from 3.95% in last week. Delhi's RValue was last under 1 on March 28. An R0 of 2 in the national capital means each and every COVID-19 patient will infect at least 2 others, which means that the number of COVID-19 cases in the upcoming days will rise sharply. An R0 below 1 means that the pandemic is under control, and this was the case in the month of March. But looking at the crowd behind me, it doesn't look like the R0 is going to come down anytime soon. Experts warn against laxity in COVID-appropriate behavior.
The number of COVID cases is definitely on the rise, and this is happening when we are trying to live our lives normally with lesser restrictions and without the masks. We have again been struck by a subvariant of the Omicron. This virus has an R of 2, while the virus in January had an R of 7 to 10. That means if in January one patient was infecting 7 to 10 people, so far the current one is allowing one patient to spread it to 2 more individuals.
Hospitalization, however, still remain low in Delhi, with only 68 patients admitted to hospitals out of 2,241 active cases.
Look, in our OPD we have observed that patients are coming with dryness of eyes, dryness of mouth, with joint pains, with muscle pain, and these symptoms are found in certain conditions like Sjogren's syndrome, rheumatoid arthritis.
Hopefully, with masks becoming mandatory in Delhi again, the situation should improve. In Delhi, with camera person Xavier Thomas, Akshay Dongre for NDTV.
So will the situation improve? What can we expect? What do we make of these numbers? Joining us now, Dr Naresh Trehan, Chairman and Managing Director of Medanta, the Medicity. Thank you, doctors, for your time. And Dr Mathur, Professor of Excellence in ENT, former Director, Additional DGHS, the Lady Hardinge Medical College and Hospitals. Dr Trehan, to you first. India is reporting over 2,000 cases a day now for the past 2 days. Delhi accounting for 40% of all of the All India cases. We've seen a rise of almost 284% in a week. What should we make of these numbers? Because I think it's safe to say that in homes across Delhi, certainly, families are sitting down, parents are trying to figure out what we should do. Do we need to change our lifestyles? What do we need to know in order to make those informed decisions?
So definitely it's very worrisome that at the speed with which the numbers are rising. Today it's even higher. The reported today by the evening was 1094. So that means that we are actually not seeing any of this abating, and the only thing to do is to sit up and get back into some of the COVID appropriate behavior that we had before. So what we are recommending today is basically masking, most definitely if you are going out in any crowded space, and in schools, we need to, the schools have to enforce the masking and distancing very strictly, because, you know, having children, they may just get chatty and and attracted towards each other, and then they take off their mask, and that's where a lot of the cases are coming from. So today, 1, masking, 2, distancing, 3, everybody should get their booster, because there has been some hesitancy we are seeing in the early days of the booster being available, but now I think that there is a turn towards numerically increasing numbers, but I would suggest that everybody who's eligible for a booster should go right away, because it's clear that it does protect you and gives you that possible edge over not getting it, because people are getting it for the 3rd time. I mean, this is very detrimental to anybody's health that you get repeated infections. So caution time, very strict enforcement of masking, and these big parties should be put to a pause for now, for the next 4 to 6 weeks, till we see this wave passing through, because Delhi is worrisome. More than half the cases of the country, or almost half of the cases of the country, are from Delhi, and the RO factor of being more than 2 is also very disturbing.
I want to talk about schools more specifically, but first, Dr. Mathur, though yes, Delhi has seen a rise of over 284 cases in a week, yet hospitalizations are still very low. So what do we make of that?
So this had been the case with the Omicron all throughout, that the hospitalization had been less, fortunately, and cases going into the ICUs and cases requiring oxygen had been very, very less as compared to what we had in the Delta wave. So meaning thereby that the disease was manageable, even if it was a lot of cases, otherwise it was manageable, and administratively it was much easier to manage this variant and the 3rd wave which we had as compared to what we had the 2nd wave, just because it behaved like that, not that drastically many things changed. So in this wave, which it's not the wave which I call, but yes, some uprise which is there in last 2 weeks, and especially in last 1 or 2 days, and especially in Delhi. We had seen earlier Kerala was higher all the time than Delhi, but this time Delhi is higher than the other states. So that is a little worrisome.
Dr. Trehan, now that we have this masks being made mandatory again in Delhi, do you think the situation should improve, or you don't see people really following that either?
So there are 2 factors to it. One, people must realize that it is spreading, and everyone's hearing about, I mean, as doctors, we hear about it like 10, 12 people a day will call you, people who you know what to do, because we've tested positive. So the fact is that this is how waves start unless we react to it right away. And I think that there is no room for complacency, because we don't want to bring it upon ourselves. And Delhi showing these numbers the way they are, also the fact that the testing is not as intense as it used to be. So we need to test more. We need to track them down and actually take the hotspots out of circulation. And I think that if we take it seriously right now, we can still get relief, because like we say, it's not a wave yet, but we don't know what will happen, because there is another variant lurking in the background, which is worrisome. So I think that the last time we learned a lesson, Omicron is mild, that's true. Less hospitalization and less number of deaths. But the point is, anybody who gets it still suffers. And in India, it becomes even more important, because the daily wage people, if they get knocked out of action for 10 days, 2 weeks, they suffer economically also hugely. So I think that there is no currency in being complacent. We should be very, very alert at this point, because it will make a big difference in protecting ourselves or stymieing the wave if we act responsibly.
So better to prevent it totally first. But Dr. Mathur, let's get your views on, schools. We finally had schools reopen after 2 years. There's been a huge setback to education in India overall. Given the fact that Omicron is milder, children, I think, don't get affected as seriously. Where do you see, because I think that debate's also taking place in governments across the country. Where do you stand on this debate?
See, there are two things in this. I would say that one thing is that the disease is little less severe in children that we have seen and established. So that is a good thing. But the bad part is that to enforce a child to wear mask all the time in the school is not very easy.
Yeah.
Whatever you may try, you can educate them, but it's a little difficult. So the transmissibility, if the virus is very transmissible, as it is Omicron, and as Dr. Trehan just said, he mentioned about another variant which has not come, but we should always be alert on that is XE. So if that happens, then schools will be, it will not be a good idea to let the schools remain open at that time. But as of now, things are not that bad, and numerically and mathematically, when we say 10% more positivity and 40% more hospitalization in the ICU beds, that will warrant, making containment zone and containment areas. So we are far less than that, and we can continue with the school for some time, but we have to watch it daily basis, every hourly basis.
Well, we are going in for summer break for schools, which is possibly a good thing in terms of timing, though of course many had been planning to travel finally after a long time. But Dr. Trehan, lastly to you, then what about the vaccine for kids? They're the only ones left without a vaccine. We're having that Corbevax coming up for age 5 to 12. Your advice to parents?
So I think that it is very important to put that Corbevax on a fast track. But it has to be validated by data and the scientific community very carefully, because you don't want to victimize children in a panic. So I think that the process should be accelerated once the data is evaluated. An expert committee has already actually gone through it and recommended it. So I think that once it is double checked, we should approve it for the younger group so that they can also be protected. So I think all the measures that we can take right now, and one thing is good, that the government does have the facilities for tracking and real-time information coming from all the districts, which is a good thing, so that it helps to contain it where it is detected. But Delhi definitely is in a danger zone, and I think this is the time we need to enforce very strictly the mask policy at least, and avoid people going into crowded spaces. If we do that, then we have done our best, because like a lot of countries have adopted this attitude of we have got to live with it. But we are not Western countries. We do have a very large population. Even small percentage of our population getting sick is very large number numerically, and it creates a lot of economic distress at the bottom level. And I think we should be very responsible about that. Just because we don't, some of the well-protected people may not get it, but then we also have a responsibility towards the ones who need to be protected. That is children, the people who are daily wage earners, and the other side effect of children getting it is that they're all living with parents and grandparents. And if grandparents get it, then we have seen, if in our Medanta ICU, if there are 10 patients, there are 90% elderly and 10% children. So that's why I think that we do have to be extremely careful. This is an opportunity to stymie the wave so that we can prevent it.
All right. Thank you so much, doctors. Thank you for your views. Thank you for your time. Thank you for your service. Thank you for joining us tonight.